The iwCLL has an interesting composition because there are scientists, basic scientists, translational scientists, and clinicians. And clearly, the iwCLL, as every other scientific community or group, is caught between two aspects. One aspect is what we would like to know. The other aspect is what we need to apply to patients. So in a sense, iwCLL is trying to bridge these two aspects and trying to put forward as much science as we can and to translate into the clinics as much science as we can, and then come back. When I say come back, I mean that once you use new drugs or you make new trials, you always get unexpected results, unexpected data. And clearly, it is important to understand why are these unexpected. And if we are able to crack those nuts, that likely will produce important advantages for the patients. So I think that iwCLL was born, I would say, in the very early 80s, in a sense as a gathering of few people who were interested in these malignancies. Those days, it was considered not very interesting. I tell you, I decided to enter the field of CLL for a very interesting situation. I was a physician, so I was treating a patient with CLL who had all range of complications, and the patient died. The day after the death of that patient, I was attending a meeting in Paris, which was more than a meeting, it was, let's say, a course. And there was the man who those days was the most important guru in the field of leukemia. And he gave a 1-hour talk on leukemia, spending 99% of his time in the morphology, in the tiny details of those days, but essentially in acute leukemia. And his last slide was a slide of a patient with CLL. And the comment that he made was, and here we have a lot of lymphocytes. How boring. And my mental reaction was, well, yes, but boring to death. So I decided that if everybody thought it was boring, well, maybe it was interesting to have a look at it. And so after a while, I was summoned in this iwCLL, and we started working together, making meetings, trying to do to push forward both science and clinical trials. And I would say that at the end of the day, that is after so many years, well, some results have been achieved because CLL has become one of the most importantly studied diseases. We have made major advances. We are not yet able to cure, at least not all patients, but we are understanding that we are very close to understand and to cure, if not all, at least most patients.